Okay. Hopefully everyone can hear me. Cool. So right now we're here for the talk on postpartum psychosis and the COVID-19 pandemic. I'll be checking the Q&A and chat in the Whova if anyone has any questions to ask or anything to say. Also, feel free to unmute yourselves or have your cameras on if you'd like. But here we have Rebecca Tutino, who is a third-year student in Fordham University's clinical psychology doctoral program. And so I'll let you take it away, Rebecca.
Awesome. Thank you so much. So like she said, today I will be presenting on postpartum psychosis and the COVID-19 pandemic. So during this presentation, I will discuss my rationale for choosing this topic, review some background information, provide a review of the literature, and conclude with the discussion. So I first wanted to preface this presentation with a rationale as to why I chose this topic. So I am a third-year graduate student in clinical psychology, and this idea was inspired directly by my clinical work when I was an extern on a women's inpatient unit. So anecdotally, a lot of the psychiatrists and the psychologists that I worked with spoke of a marked increase in postpartum psychosis, and I became really interested in this phenomenon as I worked with a number of women with postpartum psychosis during the pandemic. So starting off with a little bit of background information, I'm sure many of you are familiar with this emerging literature suggestive of an increased risk of psychiatric symptoms secondary to COVID-19. So we're seeing increased rates of depression, PTSD, anxiety sort of across the board right now. And there's also longstanding literature on a link between respiratory infections and psychosis. So most of the previous literature focuses on a link between viral infections and schizophrenia. And then perhaps more importantly, the factors linking prior respiratory infections to psychosis in adults are also present in COVID-19, particularly inflammation and neuroinvasion. And then interestingly enough, research on older strains of the coronavirus back in 2011 suggests that two strains are associated with an increased risk for psychosis. So Watson et al. Have proposed mechanisms of COVID-19 psychosis, meaning psychosis secondary to an active COVID-19 infection. So preliminary research suggests that the incidence rate of COVID-19 psychosis is around 12.8%. And I've included Watson's proposed mechanisms here, and I want to highlight number 3 in particular. So this idea of an acute stress response to the COVID-19 pandemic as a potential mechanism of psychosis. This leads me to another potential mechanism, which is an increase in psychosis due to a stress response to the general pandemic. So think of this less of, psychosis directly from an active COVID-19 infection and more of psychosis secondary to the general stress of the pandemic. So no active infection needed. There's growing evidence of this, and one paper actually reported that all patients exhibiting psychosis during the pandemic in this review without an active infection of COVID-19 presented with delusions, and these delusions were all thematically linked to COVID-19. So all in all, research suggests at this time an increased incidence of psychosis during the COVID-19 pandemic. Perinatal individuals are of heightened interest given their unique immunological status and the potential outcomes for mother and baby. Preliminary research suggests that pregnant COVID-19 patients have immune responses that differ from non-pregnant COVID-19 patients. And growing research suggests the negative impacts of COVID-19, the COVID-19 pandemic on perinatal mental health, including an increase in depressive and anxiety symptoms. So moving on to postpartum psychosis specifically. So childbirth serves as a trigger for severe mood disorders due to obstetric factors, psychosocial stressors, circadian rhythm disruptions, as well as hormonal and immunological factors. Postpartum psychosis is an umbrella term used to describe women with affective episodes with psychotic features and psychosis not otherwise specified during the postpartum period. Postpartum psychosis is typically characterized by mood swings, confused thinking, disorganized behavior, paranoia, hallucinations, and delusions. Postpartum psychosis has a rapid onset, so typically within the first 1 to 4 weeks post-childbirth. There's also extremely low prevalence rates. So diagnosis and treatment of this severe psychiatric disorder is critical, as postpartum psychosis can have devastating outcomes for both mother and baby, including neonaticide, infanticide, and maternal suicide. And then postpartum psychosis is widely accepted as a variant of bipolar disorder, and accordingly, bipolar disorder is one of the many established risk factors of postpartum psychosis. I also want to draw particular attention to risk factors particularly relevant to the COVID-19 pandemic, so stress and immune dysfunction. So given that stress has been proposed as a potential mechanism of COVID-19 psychosis, and the elevated levels of distress observed in the perinatal individuals during the COVID-19 pandemic, it's possible that COVID-19 related stress serves as a risk factor for postpartum psychosis. And then importantly, both pregnancy and an active COVID-19 infection are marked by increases in IL-8, a pro-inflammatory chemokine associated with postpartum psychosis. Moreover, MCP1 levels, a pro-inflammatory cytokine associated with postpartum psychosis, have also been reported to be elevated in patients with COVID-19. So, while substantial literature has, suggested a negative impact of COVID-19 on various psychological outcomes during the perinatal period, there has not yet been a review of the implications of COVID-19 on postpartum psychosis. So a review has the potential to serve as a future resource for providers, as well as raise awareness for this understudied phenomenon. This presentation therefore focuses on postpartum psychosis during the COVID-19 pandemic and aims to review prevalence, risk factors, clinical presentations, treatments, as well as clinical, ethical, and sociocultural considerations. At this point, there have been a total of 5 analytical studies published, which I will first report on. I will then report on relevant case reports in series, which I include a total of 16 individuals experiencing postpartum psychosis during the pandemic. So, Jansen et al. And Bider and Cocker reported on a 3- to 4-fold increase in postpartum psychosis incident, respectively, when comparing incidence rates prior to and during the pandemic. So these studies were both conducted to determine incidence rates via retrospective chart reviews using diagnostic information. So Bider and Cocker compared rates at the University of Arkansas for medical sciences from March 2020 through February 2021, and they compared this to rates back in 2015 through 2019. Jansen et al. Compared rates at the University School of Medicine, St. Louis, Missouri, and they compared from February 2020 through January 2021 to years prior, so February 2018 through January 2020. And then limitations of these approaches is that these were both retrospective chart reviews using single healthcare institutions, so generalizability is limited at this time. And then the next, Vagat et al. Suggested that visit rates for postpartum primary and psychiatric care increase for bipolar and psychotic disorders in majority of the months between March and November 2020. So this was a cross-sectional population-based study where authors examined mental illness visit rates for both primary and psychiatric care and compared rates from during the pandemic to quote unquote the expected rates, which were computed based on pre-pandemic expectations and patterns. So when looking at visit rates for postpartum primary and psychiatric care, bipolar and psychotic disorder visit rates were greater than what was expected in many of the months during the COVID-19 pandemic. So again, this does provide some evidence that we're seeing higher rates of postpartum psychosis or postpartum psychotic and bipolar disorders and symptoms during the COVID-19 pandemic. Yet we also must be cautious with this interpretation as the study was done in Canada, and we know that this may not generalize to other populations. And then as noted, it's possible that these rates are not entirely accurate either, as many individuals may not seek professional treatment for their symptoms. These two studies report on significant increases in symptoms relevant to postpartum psychosis, so psychoticism and hypomania. So Portas Gonzalez et al. Reported on the results of a cross-sectional study out of Spain, which utilized the symptom checklist 90 revised to assess psychological symptoms sort of across the board. And they report on a significant increase in psychoticism in individuals who gave birth during the pandemic as compared to those who gave birth prior to the pandemic. And then interestingly enough, perceived stress was a significant predictor of psychoticism in women who gave birth during the pandemic, again, highlighting this idea of stress as a potential mechanism of postpartum psychosis during the pandemic. Next, this next study reported on the results of a cross-sectional study out of Italy and used the hypomania checklist 32. So results suggest that levels of hypomania were significantly greater in a COVID sample than a non-COVID postpartum sample. That said, in terms of limitations, one would assume that women exhibiting, either psychoticism or hypomania would end up meeting the criteria for postpartum psychosis, but that was not necessarily confirmed by these studies, so we're unable to make those strong conclusions at this time. The case reports in series included in this review reported on a total of 16 individuals, 8 who were COVID-19 positive and 8 who were COVID-19 negative. So broadly speaking, clinical presentations were similar between those who were COVID positive and COVID negative. And clinical presentations were also similar to those previously described in the literature, with the addition of COVID-19 related delusions. So, as you can see, COVID-19 related delusions were reported in about 19% of patients. And these included delusions that, for example, one woman had a delusion that doctors on the inpatient unit were trying to make her and her baby COVID-19 positive. And then interestingly, of the positive COVID-19 individuals, so out of those 8 individuals, just 1 had physical symptoms of COVID-19, meaning that the rest were totally asymptomatic. So in terms of key takeaways, research remains extremely limited at this time, and a majority of the research is in the form of case reports or series. A relationship between COVID-19 and postpartum psychosis cannot be established at this time. That said, preliminary research does suggest a potential increase in postpartum psychosis prevalence secondary to the COVID-19 pandemic. And then lastly, given that stress is a proposed mechanism for COVID-19 psychosis and an established risk factor for postpartum psychosis, it is important to consider stress as a risk factor for perinatal psychosis. Postpartum psychosis affects individuals globally, and sociocultural considerations must be made when conceptualizing cases, risk factors, and treatments accordingly. So there may be sociocultural differences in perceived stress. So to this point, one case study described both an individual's perceived stress in response to cultural pressure from in-laws to have a male child, and the social ramifications and stigma attached to a COVID-19 infection in India. So this sort of highlights the culture-specific stressors stemming from both COVID-19 and the perinatal period. It's also important to consider differences in countries' abilities to respond to severe mental health concerns during the pandemic, as many low and middle-income countries have fragile healthcare systems, densely populated urban regions, and limited resources, including COVID-19 testing, all of which engender an environment of increased likelihood of COVID-19 infection. Treatment likely also varies by culture. So some cultures are hesitant to seek treatment for psychiatric disorders and/or do not prioritize or allow for the use of psychiatric medications. And then, of course, perceptions of psychosis vary by culture. So some cultures are more likely to describe a positive relationship with their voices than, say, individuals in the United States. In terms of ethical considerations, publications of case reports are sort of a catch-22 at this point. So if you were to report the information as is, it may result in the identification of the individual, which can be stigmatizing and or dangerous for individuals. So I've actually had patients who were identified in the news and later received threats. And to this point, I'm sure many of you have heard of a recent case out of Massachusetts that has resulted in the identification of the individual. These treatments are also very intensive, and there's a possibility of side effects. So patients may not want to consent to treatment, which may lead to treatment over objection. And then other ethical considerations include telehealth considerations. So this is something I've thought a lot about just given my clinical experiences. So patients with psychosis may present with challenges in adhering to CDC recommendations. So things like not wearing masks, not staying in their rooms, spitting on people, things like that. And then adherence to telehealth procedures may also be more difficult for patients with psychosis. So, giving a patient with psychosis an iPad with a Zoom link, not always successful. So careful consideration of the corresponding benefits and risks is warranted. And I know most of you are actually off camera, and I'll come back to this question during the discussion just so that way everyone can kind of come on camera at the end, hopefully. But in terms of limitations, so there were many limitations to this study. First and foremost, there was a limited number of studies, limiting our ability to make strong conclusions. All analytical studies were retrospective cohort studies or cross-sectional in nature, limiting the ability to make causal inferences. A majority of the analytical studies utilized self-report measures to examine symptoms relevant to postpartum psychosis rather than postpartum psychosis specifically. And of course, self-report measures, whether or not they're well validated, which these were, are limited in nature inherently. Many of these studies report on data from single healthcare institutions, further limiting generalizability. And then lastly, case reports and series were included in this review, which have limited generalizability, failed to suggest a cause and effect relationship, and are subject to publication bias. So further research is critical to better understand the prevalence, risk factors, and treatment, as well as clinical, ethical, and sociocultural considerations of this potentially devastating severe mental illness. Given that 2 preliminary studies have suggested an increase in prevalence of postpartum psychosis, nationwide studies examining postpartum psychosis prevalence are warranted. Research on a COVID-19 infection as a potential risk factor for the development of postpartum psychosis are also warranted, specifically looking at the corresponding immune changes of a COVID-19 infection. Future research on how best to treat the novel symptom of COVID-19 related delusions is also critical. And then lastly, consideration of how best to adapt clinical care, including telehealth services, is necessary. So I have my references if anyone needs them, and then I would love to open it up for a discussion and questions.
Awesome. Thank you so much, Rebecca, for your talk. So it seems like I don't see any questions right now in the chat or the Huva, but oh, there's Sherry or Cherry.
Yeah, I'd love to ask a quick. Yeah, Sherry. Thank you for a great presentation, Rebecca. I work with the PSI Postpartum Psychosis Task Force. I have lived experience of psychosis, so I wanted to tune in. I loved your presentation. I had a question about when you shared the 1 to 2 in 1,000 statistic. I understand that as an incidence statistic, but you called it a prevalence statistic. So just curious about that. That was my question.
That's a really good question. And I totally may have misspoken or, had a typo. I interpret that as an incidence rate as well. So thank you for catching that.
Yeah, so a lot of what a lot of the work that we do is trying to look at incidence, and we don't really have good prevalence numbers for postpartum psychosis. And I love that you talked about how it's really an umbrella term. That's so great. So thanks for including that in your presentation.
Thank you. Thanks so much, Sherry.
And I think next we have April, if you'd like to ask a question. Just kidding. Sorry, I just saw that you had a video on and assumed. Okay. Yeah. Is there anyone else that happens to have any questions? Or there was also some discussion points that you had, Rebecca. If you wanted to, you're totally welcome to go back to check those out if you'd like.
Yeah, of course. Well, my discussion question was surrounding the use of telehealth services during the pandemic. So I'm not sure how many of us are clinicians here, but I know I've had my own experiences, both pros and cons using telehealth services, overall, and then also with patients with psychosis. So I was, hoping for a discussion surrounding that and to hear if anyone else had any similar experiences or anything that, sort of stood out to them as we sort of, think about how we best refine these practices moving forward.
I am not a clinician, but I did want to ask another question, or I had another comment. So I thought it was interesting that you called out a few times about delusions about COVID-19. And my kind of understanding, again, not as a trained medical professional, but just as lived experience and a lot of research that I've done or learning, I should say, done on my own, would just be that a delusion would be expected to kind of pick up things from the environment. So I was curious if you felt like there was a significance to that, or just was something that showed that the amount of, like, there was a lot of fixation on COVID-19. Is that kind of more what you were saying?
Yeah, exactly. So delusions can be about, a range of different things. Sometimes they have to do with the presented environment and sometimes not. So there a lot of times, especially with postpartum psychosis, from my clinical experience, they're oftentimes like religious delusions. But in terms of these, novel symptoms of, these postpartum psychosis in terms of the COVID-19 pandemic, we saw that 19% were reporting COVID-19 related delusions in terms of, again, the example was like being convinced that the doctor on the unit was trying to make this woman COVID positive. So things like that, which I think you're absolutely right. That one definitely seems like it has to do with like the exact situation presented to them. And then there was also a study in women, in women and men. So just, broader psychosis. And this was a review of case studies of psychosis. And it was individuals who did not have an active COVID-19 infection. And when they were interviewed and sort of, they talked about their clinical presentations, for all of the delusions, there was this theme of COVID-19 related worry or concern, which I think makes a lot of sense, just given, the nature of how we're talking about COVID-19, the fact that everyone was in hospitals during these, interviews or, clinical presentations, I guess I should say. So I think, with the mask wearing and everything, it does make a lot of sense. And so that's one of the future directions too, is that, we know CBT for psychosis works, but this is a new sort of symptom that we're seeing. So to sort of test out, like, does this also work for COVID-19? Because I think you're exactly right. This one might be a little bit more like based in reality than some of the others. So I think, we have to navigate how best to treat that.
Yeah, that's really interesting. I think that maybe points even to the umbrella term for postpartum psychosis, because it's not really it doesn't have a lot of things in common with those, like, oh gosh, you've got the terms for me. My terms are failing me today, but it's kind of its whole own beast. And so maybe that might be a clue to say if things are more environmentally focused versus if they're kind of following the trends that we know kind of happens with delusions and postpartum psychosis. That might be a kind of cool differentiator to look at in the future too. So it's really cool. I really enjoyed your presentation again.
Thank you again. And very well said. I appreciate that.
Yeah, so we had one question in the Whova. I think this is in reference to your discussion point that you mentioned earlier. They just wanted to ask if you wanted to speak to your interest having to do with that topic. Maybe like start us off.
My interest in postpartum psychosis or in like telehealth services?
I think I think it was to do the telehealth services, and like what your, I guess, like opinion is on that.
Got it. Yeah. So I spoke to this a little bit during the presentation, but basically I was on a women's inpatient unit during COVID. So it wasn't, March 2020 or anything like that. So it was, July 2021 through July or June 2022. But through that year, we saw a lot, and we saw, the peak Omicron, which during those winter months, we had to sort of shift back, and it was a fully COVID-19 positive unit at one point. So I sort of saw a range of like COVID-19 procedures, which was really awesome training experience for me. But speaking back to what I saw, it was exactly true that, patients just with psychosis, they don't really understand sometimes that, there's a pandemic and they need to be wearing a mask at all times, or they can't be, super close to one another. They can't be in each other's rooms. They have to stay in their room with the door shut if they're positive. And then things like, like there's this is a really great case study out there on psychosis, not necessarily postpartum psychosis, but psychosis in general, where they talk about how during the lockdown on an inpatient unit, they had patients with psychosis like drinking the hand sanitizer, things like that like we wouldn't really think of when we're thinking of how to make these CDC guidelines and recommendations, but we have to be a little bit more cautious when we're treating this population. And then sort of on the flip, the use of telehealth services is really, really wonderful for, in terms of keeping everyone safe. But when you're giving a patient with psychosis, like in my experience, an iPad with a Zoom link and say, log on at 2 p.m. and check in with your treatment team, like there's so many barriers in place. And even, is the quality of that conversation the same as in person? And is it, pros and cons? Do we all gown up and put on our full uniform and go in the room together? Is it one person? Is it one person that holds an iPad? So many different variations that I saw personally. And I'm curious to hear how others handled this, because like I said, this was at one institution. I'm sure everyone handled things a little bit differently.
Yeah, I'll say I'm not a clinician myself, so I can't really comment, but if anyone else has any more comments on this, that would be greatly appreciated.
Well, I'll just say thank you everyone so much for coming to this talk. It's very much an understudied and underrepresented topic in the literature. And so, just by listening, and I think it's really wonderful that hopefully we can all learn a little bit more about this and be aware of it moving forward.
Absolutely. Yeah. Thank you so much, Rebecca, for your time, and also for everybody joining us here. But yeah, thank you so much again.
Thank you.
Great job, Becca. Nice seeing you.
Becca.
See you all at the
Thanks,
next
Rebecca.
session.
Take care. Thanks, Sherry. Bye.